Our I-team just discovering a multi-million-dollar contract to help improve the state's contact tracing program will now cost taxpayers 10 times more than expected. Last month, our Katie LeGrone revealed how the state quietly hired an outside firm to ramp up its tracing efforts. And new tonight, she's learning the pricey new details behind the elusive contract.
Florida's ongoing struggle to slow the spread of COVID-19 through contact tracing is getting far more costly to taxpayers. We've learned what started as a $6 million contract with a Virginia-based company has ballooned to $50 million in just a few months as cases started to spike in the state.
This contract seems really shrouded in secrecy.
Dan Bass with the labor union Communications Workers of America represents workers of Maximus, Inc., the call center provider Florida hired to beef up its roster of contact tracers. In recent years, he says, the government contractor has been accused of underbidding contracts, understaffing jobs, and underperforming projects.
What's the MO here that you're concerned about?
Maximus can try and take advantage of situations to extract extra dollars from states for these important state contracts when the circumstances are right. And this is exactly that type of circumstance.
According to the state contract database, at the end of May, Florida agreed to pay Maximus $6 million over 4 months for contact tracing services to prevent the spread of COVID-19. By mid-July, it extended to a year. Its dollar amount more than quadrupled to $27 million. Less than a month later, the deal is now worth $50 million. But in a company earnings report this month, Maximus touts its 6-month job in Florida at $73 million. Despite numerous requests, Florida's Department of Health has yet to provide us the contract, scope of work details, or answer questions about these rising costs. In an email, a Maximus spokesperson told us it is very typical for contracts to have modifications, such as an extension to take services beyond the initial contract period or changes in staffing. Typically, for volume-driven contracts like this, there tends to be a range of possible financial scenarios that depend on the level of activities. In this case, the total value will likely range between $65 million and $75 million. That may not raise questions if the state revealed more details about its program and its performance.
I've called it a failure. I've called it abysmal. I've called it ineffective. I've called it the equivalent of not having a program.
Miami Beach Mayor Dan Galber has become an outspoken critic of the state's Department of Health and its contact tracing program after watching COVID cases in his county of Miami-Dade explode.
Are taxpayers getting what they're paying for?
Yeah, I don't know whether we're getting what we're paying for because they're not keeping track of what kind of job they're doing.
The state does tell us they now have 4,400 tracers doing the job. It's unclear how many are Maximus employees or how well it's working. We've asked.
Is this how this is supposed to work?
No, it's not how it's supposed to work. In fact, it flies in the face of Florida's strong transparency laws.
Pam Marsh of Florida's First Amendment Foundation.
They have to provide performance measures so that we can have some accountability of what we are getting for our money. And at this point, it's just all in the dark, not in the sunshine.
But we're all paying for it.
We did ask Maximus about its performance here in Florida. Spokesperson wouldn't say, but did share that any performance data shared by the state would likely include all-encompassing data about the program, not just the company's role. I'm I-team investigator Katie LeGrone, taking action for you.